Assalamualaikum, Tachahau, Vanakkam, and welcome to CEKU Inspires, UKEC's first ever podcast series. I'm Balkis, the Vice Chairperson of the UKE Catalyst Office and also the Editor-in-Chief for CEKU. So just a little bit overview of what CEKU is. CEKU is UKEC's very own in-house publication that's been around since 1998. And CEKU Inspires, to all of you who's still new, it is a podcast series aimed to host conversations with inspirational Malaysians of all levels and backgrounds. So we hope to provide new perspectives to all Malaysians, regardless if you're a student, a graduate, or you're the Malaysian community in general. So together with me is our guest speaker, is from a medical background, and he is Dr. Karl King-Yong, a consultant gastroenterologist and bariatric endoscopist at St. Mary's Hospital, Imperial College. With a special interest in advanced and metabolic endoscopy, his passion is in endoscopic bariatric and metabolic therapies. He completed his gastroenterology training in Northwest London, having previously been trained in Edinburgh, Oxford, and Bath. So hi, Dr. Karl.
Hello.
Can you briefly introduce where you're from in Malaysia?
I am originally from Petaling Jaya, Malaysia, living in Bandar Utama. Contrary to some of the untrue rumors that I'm from Penang, but actually I'm not. I am from KL.
All right. Yeah. I'm also from KL, but I'm from Ampang.
Yeah. Right.
Yeah. And also, I think this is a rare thing that we do on CEKU Inspires. We want to know our speakers better. So would you care to share with the audience how it was when you were growing up in Malaysia?
Well, I think I spent half my life in Malaysia and the remaining half in the UK, where the experience of growing up in Malaysia is just like anybody else in Malaysia, all the good parts of it, able to leave my childhood memory behind, all the sweet part of it, able to grow up in Malaysia. It's not anything that I would be able to describe in words, I think. I think that's probably true for a lot of people. I grew up in late 80s and early 90s, still in Malaysia, early 2000s. And it's all the childhood memories that I cannot quite easily describe in words. When you ask me this question, I find it quite difficult to answer, because I think anything that can be described in words are probably not a true description of the beauty of growing up and living my childhood in Malaysia, that I cannot substitute with anything else.
Yeah. And you mentioned that looking at your education background that you sent me, is it true that you studied in Malaysia up to your pre-university
Yes,
level?
I did my primary school education. I finished it and then I completed it in Victoria Institution Secondary School in Malaysia up till SPM. And then actually, quite interestingly, after SPM, I went to Canada for my pre-university study. And I did a couple of years of University Bachelor of Science under scholarship before I embark on my medical journey. So yes.
That's very interesting, because I rarely hear Malaysian students pursuing their studies right away in Canada. Is there a reason why you chose Canada?
Neither have I, actually. I've not come across a lot of students pursuing studies in Canada, but there was actually a personal reason to that, I suppose. My cousin studied in Canada, so my family thought, well, there's some precedents there. They studied in Canada, and my sister, I've got a few sisters, but I'm the youngest in the family. My sister decided to go to Manitoba, Winnipeg for study, and I believe my parents thought, well, you've got your sister there, you can look after each other, and then decided maybe you should try Canada. And I ended up in Alberta, in Edmonton. Little did I know that Alberta, Edmonton it's quite a distance away from Manitoba, which was where my sister studied. So I think it's about looking out for each other that landed me in Canada for a couple of years. And I did my high school there, my last year of the high school. So it's equivalent to STPM, but it's grade 12.
You didn't graduate from Victoria Institution?
So I was at Victoria Institution from Form 1 to Form 5.
Okay,
and then I went across to Canada for grade 12, which
Yeah.
is something like the STPM of Malaysia.
Okay.
Yeah.
That's really interesting, and I can truly relate to your decision of choosing Canada, because my decision to study in the UK is quite similar, because it's always good to have family members or relatives in the same state, despite having to travel quite couple hundred miles
Yes.
from each other,
Yeah.
but can relate to that. Let's move on to the next question. Can you share with us your medical journey from sixth grade up till after undergraduate studies?
Yeah. So after I finished my time in Canada, I actually started my preclinical studies at the International Medical U, Malaysia. And then I moved to University of Aberdeen Medical School. I completed my medical school training in Aberdeen and all my initial internship and medical training in all northeast of Scotland, which include all the small little islands up in Scotland. I went on to pursue my gastroenterology specialty training in Edinburgh. So from Edinburgh, I crossed the border to Oxford for a couple of years, still in gastroenterology, subspecialty training, and then Bath, and then subsequently in Northwest London, where I was in my last 2 or 3 years of training being in Imperial Chelsea Westminster Trust. And upon completing my training, and now here I am as a consultant gastroenterologist here at St. Mary's at Imperial.
That sounds amazing and inspiring, honestly. And can you share with us how many years it took for you to complete that whole education journey?
So it started, that's a really good question. So I had to think a bit as well. The whole journey from day one of medical school to where I am today, it's 19 years.
19 years.
19 years from day one of medical school. Because generally medical school, you're talking about 6 years, 5-6 years of medical school. And then within which to climb up the ladder from year one as an intern up to the point you finish training, that will add in another 8 or 9 years into it. But I've been a consultant for a few years now. So all in all, from day one of medical school until where I am today, we are talking around about 19 years.
19
having been
years.
a consultant for a few years now.
Okay.
Yeah.
That's a lot of dedication, and I can already tell that that's a lot of patience and hard work as well, being a medical student. Can you share with us why you chose to continue doing work in the UK at St. Mary's?
Well, I think in the first instance, this is probably quite similar to all the other medical students. Once you finish your medical school, you got onto the exciting decision-making path of whether you want to stay in the country you studied and trained versus going back to where you come from, in this case in Malaysia. At that point, when I was trying to make my decision, it was as simple as, I know one day I will go back to Malaysia. I do know that. But this is my opportunity to gain some experience being overseas. In this case, in the UK, I never really wanted to go back to Malaysia very early on because I need to gain the exposure that I would have otherwise not been able to gain being back home. So year after year, it just passes by and you gain different things. And I enjoyed my training here in the UK as well, because the opportunity being in the UK is slightly different than being in Malaysia. In the UK, you get to travel all kinds of places.
Yes.
And every few years you apply for a new post to progress up in your career. And all of this, I actually look at it in a very positive positive aspect, because in order to be a physician, to be a doctor, you need to have good exposure and you need to have good experience. And there's no better way than being able to travel all over the United Kingdom to be exposed. Sooner or later, I will go back to Malaysia, and that's the reason why I wanted to gain as much as possible being in the UK. And upon completion of my training, which was a few years ago, I had to make a decision whether or not to stay in the UK as a consultant or going back. Again, similar idea, opportunities came up, and Imperial is one of the best in my mind in terms of hospital and trust in the United Kingdom. So I was given this opportunity to become a consultant here, and I thought it was too hard to let go, and that's the reason why I decided to carry on working here. And I would also add one point, it's about opportunity. When I was given the opportunity, I had the intention to get into bariatric or metabolic therapies.
Yes.
And there's no other better place than being in Imperial to be able to do this. And that's the reason why I grabbed hold of this opportunity and tried to expand and explore further, which year after year led to a few years being in Imperial now, which it appears to be the best decision I've ever made, is to stay back up till today.
I'm just also curious. Are there any similar opportunities in the field that you chose specifically back in Malaysia? Is the opportunity and facilities different?
That's actually a very good question as well. I explored this actually in terms of opportunity for bariatric endoscopy and metabolic therapies. I must say, in Malaysia, if I'm allowed to say, I would say that we are a little bit behind the curve. This is not really an area that has advanced an awful lot. We do have some bariatric doctors in Malaysia, predominantly surgeons. But the bariatric endoscopy side of it, I think there's a huge room for innovation in Malaysia.
Yes.
So up until now, I feel that this is a slightly restricted area and lack of opportunities in Malaysia. But it goes without question that this will take off in a big scale in Malaysia. If not within the next 1 year, it'll be within the next few years.
Yeah. And it's really good to have you being a doctor here, and you can certainly contribute all your expertise and experiences back in Malaysia when you decide to go back. And one last question regarding your background. I think all our audience are curious too. Why did you choose this field? Not cardiovascular, not any other general practitioner field?
I think I say this to all medical students for a start. The basic thing that you need to find out is what you're interested in the field of medicine or surgery. First decision to make. I was very clear that I'm not going into the field of surgery. I made a decision to become a physician. And within the physician umbrella, you've got lots of medical specialties which you have alluded to. Then within that, it's about what your interests are. So I was very keen in doing a specialty with lots of hands-on, a lot of interventions and things that I can do with my hands. So that actually reduced my option to just a field like cardiovascular or gastroenterology being the two main internal medical specialty. Then I asked myself, very simple question. Yes, you're interested in them, but what does your personality suit?
Yes.
So this is about knowing yourself. So I narrowed it down to the few physician specialty, internal medicine specialty with hands-on, lots of hands-on. But which one do you suit? I felt between some of the other specialties like renal medicine, cardiovascular, and gastroenterology, that my personality would suit something with more adrenaline rush. But at the same time, I also like to have variety, a mixture of adrenaline rush, which we get a lot of in gastroenterology. We deal with a lot of acute situations with split moment decision-making situations. along with variety in the field that you are in, that actually puts me down to only gastroenterology that I was interested in. So gastroenterology has always been my top and main specialty that I want to be, and within which, how did I get into the field of bariatric metabolic therapies? Again, it's about assessing the need of the medical, the need of the society. Well, when I look at what we are doing now, not just in the UK, not just in the Malaysia, but worldwide, we are doing a lot of treatment of conditions that are already there, but not a lot out there for preventative medicine to prevent things from happening in the first instance, like to prevent diabetes, to prevent high blood pressure, prevent cancer, to reduce the risk of all these conditions. Well, I asked myself one question: what is one thing that I can do that make a big difference in trying to prevent all this, what we would term it as comorbidities of the society is facing now? Obesity is one that comes to my mind. And with that, I thought, well, why don't I do something related to obesity? And basically that then led me to do bariatric endoscopy and metabolic therapies.
Yeah, that's very interesting to know. And I'll be very honest, before I got to know you, I never heard about this field and all these procedures before. Never knew that you could have a very simple surgery that can reduce the volume of your stomach, and it will like prevent a lot of weight gain, right?
Yeah. I think the first thing to say is this procedure, I think you refer to, is endoscopic sleeve gastroplasty.
Yeah.
It's a bit of a mouthful. You can call it ESG. Yeah. It's often confused with surgery. Well, it's not a surgery.
It's not surgery.
Yeah. So the gold standard all this while had been surgeries like bypass operation and surgeries to reduce the volume of the stomach. This is not a surgery, however, it's a minimally invasive procedure.
Yes.
Because it still involves putting a patient to sleep, and then you will perform the endoscopy to stitch the stomach up internally to reduce the volume of the stomach with no incisions or cuts, with very safe safety profile. So this is actually a procedure that has been around in the US more commonly, and other parts, and even South America. In Malaysia hasn't quite caught on to it.
Yeah.
Exactly. That's the reason why I don't blame you. I don't hear an awful lot about it. And to be honest, a lot of gastroenterologists I come across have not even heard of it. Oh. So you're not the only one out there. So a lot of gastroenterologists haven't heard about it, or even haven't seen it. So you're not the only one. So because it's quite an innovation. Which is popular in certain parts of the world, but not so much in Southeast Asia, for example, until recent times.
Yeah, so would you say these procedures, is it available in Malaysia?
Well, I think this is a loaded question. Okay, so I think question. I'm hoping this will come available in due course.
Okay.
So I'm hoping the sooner the better, because I'm not sure you're aware that Malaysia is one of the biggest problem of overweight issues in Asia.
Yeah, that's a well-known
and also
fact.
Obesity.
Yeah.
So it's not just a mild problem. It's one of the worst in Asia.
That's true.
So I do feel that whilst this procedure doesn't take away the need for surgery, which we still need surgery, being one of the gold standard for many years for treatment of obesity, but I do feel that ESG is a well needed procedure at our disposal to tackle obesity in Malaysia.
Okay.
Yeah.
And if you were to go back in Malaysia in the future, would you introduce all these innovations in the healthcare system?
Oh, certainly. I mean, within my ability, if I go back to Malaysia, and if and when I go back to Malaysia, this will be the main area I'll be looking for to develop in order to contribute to the society. Okay,
that's really good to know. And just from a normal Malaysian citizen, maybe from an M40 background, do you think this procedure is affordable?
This procedure hasn't gone through the proper pricing yet in terms of fees that Malaysians would expect to pay. I would have thought that this procedure either in private sector, if we are focusing on the private sector, it also depends on the pricing.
Okay.
For a start, the procedure will be more expensive or costly, but as the volume grows and when the demand grows, then the cost of the procedure would also drop,
Okay.
and which will make it more and more affordable for more Malaysians,
Yeah.
which is very well needed. So I don't know the exact price to answer your question, but it also depends on supply and demand.
Okay.
Yeah.
Completely understandable,
Yeah.
especially when it's really new to the market. So the entry price would be quite high.
That's right,
And,
yeah.
But it will gradually become lower and lower if Malaysians understand the value of it in the future. That's really interesting.
Yeah.
Now that we know your expertise even more, even I believe that we need more people like you, doctors like you in Malaysia, to tackle a lot of health issues in Malaysia in a more innovative way, in ways that we've never thought of before. Okay, so I guess that's all for your personal background. Now we're gonna move on to issues on the ground in the healthcare sector in Malaysia. So as we know, Malaysia's healthcare system has been subjected to its fair share of issues, such as health workers leaving the public system, or there's an overload of doctors by the lack of facilities. So as someone who practices medicine abroad, what do you think are the hidden problems regarding Malaysia's healthcare system that the public is not particularly aware about?
Well, I think, as you said, I've never really worked in Malaysia. I was not trained in Malaysia, and there might be some inaccuracies because a lot of what I've heard from my friends who are trained in Malaysia is still under the training program, and some of them have now become a specialist in Malaysia. So I think the first one of the main challenge of getting through medical or surgical training in Malaysia is the structure.
Yeah.
UK has been well known and has been a hub to produce qualified doctors through their journey, including producing consultants. And that has given UK the platform to be able to develop a training structure. Now, a training structure is really important because it allows quality assurance. So in order to train a doctor, there's a lot of considerations because just like any other fields, of course, you have risks and benefits of every single decision you make. But in training a doctor, you need to make sure that the training is good enough for the person to come out to lead the healthcare system. As you are dealing with human life, you probably only have one chance.
Yeah.
In most circumstances, without being overdramatic and exaggerating. So a training structure is important for quality assurance. And also, it's very important to have a training structure in order to regulate the doctors that come out from the other end of it. Now, from my understanding of Malaysia, which is not a lot because I've never worked there or trained there, is that perhaps there's not much or the framework isn't as clear-cut as being in the UK. And that's one thing that I did not quite realize until I speak with some of my friends who are currently in Malaysia and being trained. Whereas in the UK, I can comment a little bit more because I started off from here and I went through the system throughout so many years. So it's all competitive national and international application. So in order for that, you actually pick out doctors to get into medical school as well as graduating from the other side and moving up the training system with a very formalized review on an annual basis. So for us, every single year to move up the training ladder, let's put it this way, training ladder from intern to general physician training, specialist training, and coming out as a consultant at the end of it, we do have to go through annual review. So when we get through the training, they'll review a portfolio. You'll actually have an interview every single year with a panel of specialists, made up of consultants in your region, and assess whether you've met your curriculum targets, whether you have met the competency targets, which is different every single year. So this year, you'll need to meet all these criteria to move up to the next level. And then after that, you have to meet a different set of criteria to move on to the next level. So this is a very, very structured training program, which, correct me if I'm wrong, I don't think Malaysia has that sort of annual assessment to be able to move trainees up. And that's one thing, in my mind, I might be a bit biased here, being trained in the UK, is crucial. And in fact, it's not as easy to move up the ladder. And therefore, ironically speaking, some people even prefer to come across and go through this system than being in Malaysia.
I see. Yeah. Do you think Malaysia is capable of implementing this kind of system, the one that you've been going through in the UK, considering that it's more effective? Yeah.
I mean, this is just a matter of opinion. I'm sure there are people out there who feel that this structure that we have is too restrictive, and some people may not like it. So my opinion doesn't represent everybody's opinion. Is Malaysia capable of doing that? I'm sure Malaysia is capable of doing that. It's just whether the general public and the general feeling amongst trainees and doctors feel that is feasible. So yes, I think they can, but feasibility is another question altogether.
Yeah, I agree. Yeah. Because for you to change a whole structure that's been there for years, it would take a whole reform from the top to bottom, and like everyone to do it, it would take a lot of time and effort.
Exactly, yes.
Yeah. I think that's also a reason why that's something that's been holding the whole system back, because it takes a lot.
But also you probably need the right personnel to evaluate the feasibility of this. So if you've got somebody with experience in this, apart from in the UK, somebody from the States or somebody from the Australian Medical Training Association, if there are relevant and correct people around to be able to discuss this further, I'm sure they will iron out, because every system has its pros and cons. It's not just all about pros about the system in the UK. Malaysia has its pros as well in terms of the training structure. So if everybody can put their head together and make a system that is both feasible as well as both beneficial as well to the trainees in Malaysia, I think that's the best way forward. The most important thing is having the right people for the right tasks.
That's absolutely true. And I believe we can further discuss this with the correct people in the future. Maybe you can also bring forward your ideas, maybe the structural reforms that you wish to see in Malaysia. And we'll have the chance to meet Tan Sri Dr. Nur Hisham in the future. Okay, so
I'll be happy to contribute in whatever way.
Yes, of course. Okay, we'll have a short 2 minutes break, and then we'll reconvene with the next question. Right. Thank you.
Thank you.
Okay, so welcome back. We had a really short 2 minutes break, but we're back with more follow-up questions to ask to Dr. Karl. So this question is actually a follow-up question from an event that I attended last month. It was an event organized by the British Malaysian Society, celebrating 40 years of legal and other educational links between the UK and Malaysia, where you were one of the panel speakers of the forum. And I was intrigued by one of the statements that you made during the forum the other day, where you said, Malaysians don't have to be physically in Malaysia to contribute back to the nation. And healthcare workers practicing the UK can still contribute to Malaysia by finding out ways to give back the expertise that they have, even if they're not in their home country. So can you explain more what you mean by that, and maybe share with the audience what are the ways that people can still contribute to our home country despite being away?
Yeah, you're right. I did make that statement in that event. I was probably I was the only medical professional there.
Yeah.
We were all from the legal and law society. I think the idea of having to be physically in Malaysia to contribute to Malaysia, I think it just oversimplifies the modern day that we're living in now.
Yeah.
Medical or not, is not that much of a truth nowadays. We are not like 50 or 60 years ago, or even 100 years ago, probably that was true. Now, with IT and with the borderless world that we live in right now, I feel that if you have a skill set or you have something to offer, again, whether you're talking about medical or non-medical, you can always contribute cross-border. Nothing stopping you from doing that. Say if
Agree.
in my particular area of expertise, I can offer a skill set, for example, that I feel Malaysia will benefit from, the Malaysian medical community and the society can benefit from, you can always travel back and do some procedures that you think it would benefit the society and try to expand it.
Yeah.
Yes, I'm based in the UK. Yes, I'm based in Imperial in London, but nothing stops me from doing that. That's one example that I was trying to allude to about contributing back home whilst being abroad. So that's in terms of offering a skill set. Well, if you talk about education, you can always have, education on Zoom's meeting. You always can give a lecture and stream live, or playback session, or on-demand viewing for people in Malaysia. You can easily give those talks, and that's contributing cross-border from the education point of view. So yes, you can always contribute. You don't have to physically base in Malaysia to do that. So it takes a bit of arrangement. It takes logistically a little bit of challenge here and there, but it's entirely possible in my mind. But again, some people might have a different feeling on that.
Yeah. I get how some people would have a different feeling because when you work abroad, the amount of hours that you give back to Malaysia is lesser compared to if you're a full-time worker in Malaysia. But it's really good to have a different perspective where it's completely possible for you to still want to give back to Malaysia if you feel like what's best for you right now is to stay abroad and gain all the experience. Because even for Dr. Karl, you mentioned that one day you'll return back to Malaysia. And I feel like maybe the audience can resonate with us that a lot of you may also feel like it's good to have a lot of experience abroad, but in the end, we'll all want to go back to Malaysia, maybe because of a better living standard or lower cost of living or better opportunities, or simply because we want to be with our families. Those are all the factors. But it's really good to know Dr. Karl's take on brain drain issue, which has been talked about by a lot of Malaysian students and even professionals in Malaysia. And the next one that I'm curious about was during the forum as well. You mentioned that the UK and Malaysia's healthcare system is becoming more similar compared to back then, maybe 30 or 40 years ago. So the healthcare training and the facilities is more established in the UK. So you explained that's why a lot of Malaysian students come to the UK to study medicine. But now Malaysia and the UK healthcare system, you mentioned, is a more equal level playing field. So how is that true?
So, like I said previously, the UK, the British education system, Malaysia is not that different because it's part of Commonwealth back then. And similarly, medical training, UK has been established for a long time. And that's the reason why a lot of doctors, many years ago, 50 years ago, 60 years ago, started their training in the UK. Again, similarly, because UK has the setup infrastructure and the training system, which was very mature, and started the training here. Some of them would have gone back. Once they've gone back, they will be able to bring the ideas of training back home in Malaysia. In order for that, so one by one, the more these doctors being in Malaysia, not just in the UK, Australia and the US as well, then they'll be able to formulate and train doctors, the more junior next generation of doctors, similar to what they've learned in the UK
Yeah.
or from the countries that they went back from. So you will realize that though it's a bit slow, but naturally you feel that the training, although it's not the same, will become more and more similar over time.
Yes.
And this is what I see as well. Although you can't replicate every single thing, but the idea of training is there. And also, one other point I want to make, we always talk about doctors from the UK wanting to learn and experience and go back to Malaysia and contribute. Well,
Yeah.
it goes both ways. One you may not realize is that a lot of local British doctors would have done some of their medical elective in Malaysia.
I see.
They have the same idea. They want to learn certain things in Malaysia to bring back to the UK. This is almost nothing that is being talked about because
Yeah.
people always think about bringing something back to the UK. Well, actually, people go to Malaysia and try to bring something back to their home country.
Yeah.
For example, very, very easy example. Well, we have barely any dengue fever here. We barely any parasitic infection here.
Yeah.
Well, when they go to Malaysia, they'll get to see things like leprosy or infectious diseases that they don't get to see here.
Yeah.
So actually, it goes both ways. So this is what I would call knowledge transfer and knowledge exchange. And the term that they use is cross-fertilization in both countries.
Okay.
So this is not something that a lot of people talk about, but it's true. It's both countries will benefit from each other from this relationship, education relationship.
Yeah.
Yes.
And this education relationship has been there since how many years ago?
Oh God, like there are much more senior doctors here who were in Malaysia doing their time and doing their medical elective up to a year before they come back to the UK. It has been ongoing, but it's not something that people talk about.
Yeah,
Yeah.
of course.
Yeah.
Even I can say that having like medical friends
Yeah.
or just being a common Malaysian student,
Yeah.
despite not having a medical
Yeah.
background,
Yeah.
I rarely see any medical professional emphasize on
Yeah.
people from abroad learning things from Malaysia and how Malaysia has so many things to offer to other
Yes.
countries as well.
Malaysia has a lot of things to offer because we also have a unique, for example, a setup, and the patient population is different than the West. So from medical point of view, again, I'm focusing on medical side of things for obvious reasons, is the opportunity to learn things that I may not have experience for.
Yeah.
I'll draw similarities with people going to Africa to learn about
Yes.
certain things. So every country has something to offer, every
Yes.
single country. So then it's not just about UK learning skills in the UK and bring back to Malaysia,
Yeah.
because it goes the other way around as well. So I just want to emphasize this point that a lot of people do not realize that it goes both ways.
Yeah, certainly. And I think it's really good for future doctors or any Malaysian student out there to keep that in mind, because it's not just us learning things from abroad or learning from other people's culture, but it goes both ways. And how do you envision this relationship will foster in the future? How will it benefit the UK and Malaysia?
I think this relationship will last for the longest period of time in the future, because I cannot see any downside to this relationship. If anything, it will grow. It will grow and
Yeah.
it will grow. Not only I predict, not only Malaysia will continue to have a good education system between and links and tie up with the UK, it will also continue to have good links with Australia and US and other countries as well.
Yes.
And now more and more in China as well. So the more collaboration and the more you work together outside of your own comfort zone, which is in Malaysia, the better it is for the country. Because again, mutual learning. We should all be focusing on mutual learning, and that's the only way and one of the main way of pushing the country forward.
That's really amazing. I really like how you put it and how it's all about learning together and having a growth mindset that we can all benefit from each other and not just what we mentioned earlier.
Yeah.
And
absolutely,
moving on to the last question. Actually, second last question, because before moving on to the closing one,
Yeah.
just wanted to know your thoughts on Malaysia's public healthcare system, where the Minister of Health, Deputy Finance, Norazman Ayub, says that the public healthcare system is actually nearing its end of capacity because there's too many sick Malaysians and 80% of public hospitals are full. So how can Malaysia progress in terms of that? I mean, we know that the private sector in Malaysia is flourishing, but what about those who can't afford the private sector and they are still in need of those services?
Yeah, I'm afraid this is, I have no good answer to this. This is not a problem unique to Malaysia.
Yeah.
Public sector is stretched everywhere in the world, and it remains a $1 million question on how to meet the ever-rising demands on public health care and the resources that you have. So unfortunately, there's no easy answer to this. And obviously, you can't keep building hospitals in order to accommodate the patients because resources is limited, and that includes relevant professionals, medical professionals, nursing for hospitals as well, and nurses. So there's no easy answer to this. I think unless the budget goes up and make sure that appropriate medical facilities are being afforded to all the patients. Otherwise, there's no easy answer to that, really. And the public sector and the private sector actually works very closely in Malaysia. And Malaysia has this unique landscape where I feel, this is just my opinion as well, that the private sector is so well established in Malaysia. I think if you put aside patients who can afford or patients who cannot afford private healthcare, I would look at private sector as being able to share a lot of this responsibility of looking after patients in Malaysia. So I think this is quite unique because I would compare it to some other countries, such as in the UK, where NHS is still taking a big bulk of the patients. But in Malaysia, it's quite different. Based on my experience, a few times I've been back to explore the landscape. I believe the private sector is taking a huge chunk of patient care in Malaysia, and I hope in time that would also ease the pressure on the public sector as well. But there's no easy answer to this. I think people have been debating on this and how to sort this out in the limited resources and budget that you have for healthcare and trying to cope with the ever-increasing demand of sick patients or healthcare needs.
That's
especially as elderly, is aging population as well. So,
that's a fair take on that because it's a global issue as well. And all countries are struggling with this problem. And lastly, just for the audience and for the benefit of the medical students that are watching us today, since you are here and we feel like a real life story ought to inspire young prospective doctors out there who are watching us. So can you tell us personally why you chose medicine as a career, and if you have any advice for those unsure of settling upon medicine in the future?
I think this is a few parts to this question. Why did I choose medicine? Well, growing up, I think coming from a typical Asian background, there are just a handful of career choices that you have, really. But at that time, more than that is that I've got a lot of peers when I was studying with me. They either end up as engineers in doing a law degree, medicine, or dentistry. So actually, it was quite simple. During growing up, I made a decision, let's do medicine, because I was thankfully at that time, academically, I was able to get into medicine. And I thought, let's get into a career of medicine. You'll be able to help an awful lot of people to a different scale and different ways. But equally, I think we were quite practical at the time. We thought as being a doctor, you have some career and job security. And I thought if you can help somebody and help a lot of people for that matter, and you have got job security, it sounds like a no-brainer. And then your other part of the question is
what if there's medicine students out there, but they're still unsure if they want to proceed medicine as their whole career? Because even in the earlier part of the video, you mentioned it was 18 or 19 years.
Yes, it's quite many
journey.
years. Yeah, so I mean, my message to current medical students or students who might think they want to do medicine, to first ask yourself whether you what is your main goal of life. A lot of people are being inspired by the wrong reason, I'm afraid to say, having come across so many students and even young doctors. They are inspired by the financial gains they will gain out of medicine. And I don't think that that's the right attitude, because if you're inspired by that, you should probably do something else which will be less time consuming. You'll do other fields, because it's much more of a marathon doing medicine. Because going through medical school and training takes so many years. If you're just motivated by financial gains, you won't be able to go through the distance. You will drop out halfway. But if you're inspired by the correct reason, again, in my opinion, is passion and the hungry to innovate and help the society in a bigger scale, so much greater cause, let's put it this way, then you should and you will be able to get through the years of training and medical school. And more importantly, you'll be able to succeed in medicine. I think most students, they want to succeed, but if you're inspired by the correct reason, passion, motivation, and love for medicine, then you should be able to go the distance and succeed in the future.
Yeah, it's really inspiring to hear that message from you, because even as an economics student and someone I have family members who are doctors as well, and I can see how hard it was for them to study medicine and how it's really time consuming and it requires a lot of dedication, because the amount of study that medicine student put is like double or triple the amount that people in the finance sector actually invest in. So I have a lot of admiration for those in the medical field, actually.
I want to make this other point as well. I think it's also a misconception. And I can speak on behalf of a lot of other areas of professionals. Medical students, yes, they study hard. And yes, in medical career, medical training is hard. But you're looking at it from a perspective as a doctor, as a medical student. Other fields, other professionals have stresses that doctors do not understand too. So what I'm trying to get at is, medicine is not the hardest career choice. Every professional and every career path that you take in economics, law, or anywhere else, in mathematics or whatever that you do, have their own stresses. They are also quite hard work. I mean, the corporate world is different than the medical world. So every single professional out there have stresses. And yes, they may not have gone through so many years, but then they have own stresses as well. So as a doctor, it's not unique to doctors. Every single professional have their own stresses. So that's one thing that I tell all the medical students that come through the hospital, as well as the trainees that is trained in gastroenterology coming through under my training as well. So I say the stress that you have is not unique. Everybody will have that, be it medical or non-medical. So if you have that mindset, then you won't feel so depressed and demoralized going through the years.
That's true. I have to agree with you on that, because there's just so many types of situations out there, unique to every field, and they all come with unique solutions as well. And it's not easy for us to arrive to that conclusion, because it requires a lot of innovation, not just in the medical field, but also in all other fields.
That's right. I mean, just think about what you would like to do, but also think about, assess yourself whether you're suitable for medicine. And it goes both ways. As much as you choose a career, the career chooses you in a way. It all sounds very deep, but it is true. So you have to be suitable for that career you choose as well.
Sorry. Yeah, I think for students watching us, we should really reflect on what kind of career path we want to do, because it will be the choice that will stick with us for the rest of our lives. So just take your time to decide on that, and no pressure as well. And I guess that's the end of our conversation with Dr. Karl. It's
Thank
been
you.
truly a pleasure to have you as our guest speaker for CEKU Inspires, and also the first ever podcast under UKEC. So it's really an honor to have you here.
Oh, thank you very much. I hope I've given some insight into my career that can help other students.
Certainly.
Yeah.
I think the viewers watching that, maybe you can comment down below on YouTube what you think, what's the most valuable insight that you gained from this podcast, and maybe what are the things that you wish to see from CEKU Inspires.
Thank you.
Thank you so much.
Right.
Stay tuned for the next episode. Thank you.